And I'm recording right now.
Okay. Vish, can you just confirm that you can see my screen in the presentation?
Yes.
Excellent. Okay, then I'll make him start. Welcome everybody to the Fellowship in the Academy of Wilderness Medicine Student Interest Group. Our lecture series continues with my presentation today on wilderness and the elderly. This has been quite a fun presentation to put together. I've had to do quite a bit of research because there isn't much out there in terms of information on older people or the elderly in the wilderness itself. However, we do know, as we have an example here on an opening screen, that we do have a lot of elderly people that are taking part in pursuits in what we would define as the wilderness or a wilderness setting. For example, Everett Kalin here, he's 93 years old, an American, completed the Half Dome hike in the Yosemite National Park. He did that as most recently in July 2023 at 93 years old, and it's not limited to his exploits. This is most definitely an elderly person who's gone and accomplished some extremes. For those of you that don't know me though, my name is Tim Cranton. I'm a member of the faculty for the College of Remote and Offshore Medicine. I'm also an ex-British Army combat medic and NATO Special Operations medical instructor, and a few other things on my resume that include being a paramedic, fire and rescue. And I currently work as a remote healthcare practitioner. Predominantly, I'm working within the oil and gas industry, but now and again, my pursuits and adventures will take me into a wilderness setting. And I'm getting into my senior years myself now, so you can probably count me as being elderly too. I've got a little bit of experience in the subject. So as I said, today's lecture is about wilderness and the elderly. And in terms of the contents of my lecture, I'm going to be looking today at the definition of what we define as being elderly. We'll look a little bit about the background. We're going to kind of specifically focus on geriatric medicine because this is the area of medicine that really covers the elderly person. We're going to look at what's called the GEMS diamond. I won't describe that now. We'll go through that in a bit. But I want to also concentrate on the changes in the body as well with age. I'm going to look a little bit at toxicology and also focus again on trauma in the geriatric patient. But we also have guidelines that we can consider and how we might classify somebody as being elderly, and not just how we would classify a person or persons, but also how we would classify activities as well. Hopefully I'll be able to summarize that for you. And I've also collected some resources, so some after presentation reading that you can benefit from. So how do we define elderly or the elderly person? Well, fact, you are only as old as you feel, and the younger you feel, the more people are needed to look out for you. That's my direct quote, because that's how I feel as somebody who's getting older. So I'm now 55. Some people may think that's quite young, but you know, I've covered quite a lot of things, but I'm still doing an awful lot of activities that I did when I was in my 20s and when I was working my way through my military career and into my career as a civilian remote healthcare practitioner. I've maintained a standard of fitness because I felt that it's very important to do that. And I feel that there are benefits to that in terms of my quality of life and the things that I am still able to do. The elderly still climb mountains. I can put my hand up for that. It's just their definition of mountains has changed considerably. And we're not necessarily talking about a physical mountain like Everest. We're talking about challenges. A challenge, a physical challenge, could be a mountain that you want to climb. There's no universally agreed upon definition of old age. And this is something I found quite interesting during the course of my research for this lecture. And while chronological age is a common reference point, We also have functional age and the presence of age-related health conditions that will also be important factors for us as healthcare practitioners in determining whether an individual is actually considered to be old or capable of carrying out an activity. So historically, and in terms of activities and ventures into the wilderness, most extreme performance ventures don't include elders. Most certainly things or activities like base jumping. But there are instances of incredible physical performance from older individuals, as demonstrated in my opening slide. Data regarding elders tends to come from organizations and government services such as the National Park Service in the US. And a lot of the literature that I have been able to look at and study regarding this subject has come from the US. I've not found an awful lot of information available to me from a European setting. There are several organizations and clubs that are out there that cater for the older person. And you know, people participate in all sorts of things. There's a travel company out there called Dragon Adventures, and you can do the what's called the Golden Triangle and travel through Asia from Vietnam, Cambodia, and Thailand. And I've actually done that with a group of seniors, and they were into their 70s, been retired for a number of years, and were still acting like teenagers, and were more than physically capable. While the availability of such of these organizations may vary by region and also by country, I've managed to get some examples for you as well. So we've got Elder Hostel. Now, Elder Hostel is known as the Road Scholar. It actually offers educational travel programs for older adults, and that includes some of those outdoor and adventure activities. The Adventure Cycling Association, this association promotes cycling touring and backpacking. It's got members of all ages, so it's not just elderly people, it's also younger people as well. And these people embark on long distance cycling adventures. The Silver Travel Advisor, I think this sounds good when the hair starts to gray. It's an online community, but this provides information and resources again for older travelers, including those travelers that may be interested in adventurous and extreme travel experiences. Last but not least here, we've got the International Council on Active Aging. So whilst this is not a specific club I found for extreme sports, the ICAA promotes active aging and offers resources for seniors looking to engage in physical activities that includes adventure sports. So why would an elderly person or somebody who's getting into their older years, maybe post-retirement, wanting to go out into the wilderness and pursue adventurous activities? Hard work, family and fiscal responsibilities, and due to that, a delayed gratification are characteristics of most of us that live in the Western world. We wish we could have done these things when we were younger, but we couldn't because of our jobs, because of our careers. But now that, kind of things are slowing down and we're seeing more of a gap in terms of our careers, we have the opportunity to do some of the things that we wanted to when we were younger. Retirement approaches, leisure time has increased. So us seniors, so that's me, I guess I come under that label, we begin to increase our participation in recreational and outdoor activities. The old adage, we're making up for lost time. But maintaining a good level of fitness is an excellent tension and stress reducer. And being able to take 5 minutes of time to yourself, or with a select group of individuals that you enjoy the company of, to pursue some tranquility and solitude away from that everyday hustle and bustle of life, of work, of living in a city. It's really good for the soul, it's enriching, and at the end of the day, it's good for your health. So why not? Why wouldn't you opt to do something like that? So in terms of demography, there's a striking increase in longevity during the 20th century that's changed the age composition of Western civilization. What does that mean? Well, basically, people are living longer. In the US, again, I'm kind of defaulting to the US because this is where the bulk of my information's come from. The population older than 65 years was projected to increase from 35 million, so that was 12.4% of the time in 2000, to 71 million. So an increase up to 19.6% of the population by 2030. In terms of numbers, that's a significant number of people. People are living longer. So of the 18 million people that are aged between 65 and 74, most of those people have retired. And it's stimulated an urge in us, a surge in vigorous outdoor recreational activities. But what we have to consider is a lot of those people, a lot of us, are at a medical risk, because getting older is not without risk. Their age does change a person physically. Lifestyle is considered an important part in longevity, more so now, I think, than ever before. So we've actually got 5 locations in the world where individuals not only live to ages beyond 100, but they're actually expected to do so. And we have research that demonstrates that. And speculation suggests that this longevity is due to a combination of factors that does include a genetic selection, but most predominantly a physically active lifestyle. So a chap called Dan Buettner, as part of a National Geographic expedition, wanted to study the secrets of longevity, and actually found during the course of his travels worldwide that there were 5 places around the world where people consistently lived over 100 years of age. So those places were Sardinia, it was Okinawa, so Sardinia, in Italy, Okinawa, which is in Japan. We've also got Loma Linda. So Loma Linda is actually an Adventist community in California, and they outlive the average American by a decade. One of the reasons is because they take their diet directly from the Bible, so they consume what's essentially a vegan diet, but they recognize the necessity for downtime, for self-reflection, and for a more spiritual lifestyle. We've got Nicoya, and we've got Ikara. So this is these tiny Aegean islands. These people tend to live 8 years actually longer than Americans do. And they actually experience 20% less incidences of cancer amongst their population, and half the rate of heart disease. And again, this is usually down to eating a variation of Mediterranean diet, which we know is very healthy, and contains a lot of fruits and vegetables. So it's not just about the exercise. We also have a demonstration that diet plays a big part in longevity, and the elder's ability to be able to perform more extreme pursuits. So statistically, the likelihood of having an accident or an incident in the wilderness is going to be influenced by a combination of factors, and it cannot be solely attributed to age. Both older and younger individuals can experience accidents or incidents in outdoor environments. So we have all age profiles that venture into the wilderness, and the risk profile for each of those groups differs quite variedly. So it's important we need to consider these factors when we assess who is more likely to have a wilderness accident. So I cannot say, in summary, at the end of this, the older people or the elder person is going to have an accident or an incident in the wilderness any more than anyone else. And there is very little research and evidence to suggest that the older person or older people have more medical incidents in a wilderness setting than younger people. So what do we mean then by the term old or elder? Well, if we're thinking elder or old, we tend to think of people that are usually older than 65 years of age. And if you are 65 years of age, in terms of the medical community, we determine that that person then becomes a geriatric patient. So geriatrics is the term that we use in assessment and treatment of disease in a person who is generally older than 65 years of age. However, if we have psychiatric patients, we can have psychigeries, and that age actually drops by 10 years to 55. The process of aging is gradual, and it starts much earlier than a lot of people realize. So there are some general considerations we need to think about when we have elderly or older people going into a wilderness environment. And it's important to understand and appreciate how the life of an elderly person might differ from us as a rescuer or as a medical provider. Remember, time and patience to interact with anybody, not just an elderly person, if we were going to have to manage any condition that we might come across in a wilderness setting. At the end of the day, it doesn't matter how old you are, we always treat our patients with respect. So, guys, as medical providers, we should make every attempt to avoid ageism. Just because somebody looks old, in inverted commas, bit of a silver fox, having the gray hair and the gray beard, doesn't mean I am old, or I feel old, or I behave like an older person. I know, for instance, in terms of members of my own family and also friends, I could put two people side by side that may be what I would consider elderly, as in they're in their mid-70s. But those two people that I could put names to now are very different in terms of their outlook on life, but also their physical health as well as their mental health. So we can't always say that every 70-year-old is going to be the same. So we need to make every attempt to avoid ageism. Not all old people have dementia. Not all old people are hard of hearing, and not all old people live a sedentary lifestyle and are immobile. So common complaints and the leading causes of death in elderly people comes about because of the changing physiology of what we would call or determine our geriatric patients. And that can predispose this particular population to a host of problems that we don't tend to see in youth. Things like hip fractures are common, more likely to occur where bones are weakened by osteoporosis. And osteoporosis can be a disease process that goes missed for a considerable period of time. Again, if we have people that are less active, so that sedentary behavior, that can lead to other disease processes like pneumonia and also blood clots. I've actually taken a table here from one of my paramedic training manuals. And we've got common conditions here, leading causes of death in our geriatric patients. So common conditions here include hypertension, we've got heart disease, cancer, diabetes, sinusitis has managed to work its way in here. But we can see there that the higher ups, nearly 50% high blood pressure, hypertension. But that can also come about because of lifestyle and lifestyle choices, i.e. the consumption of alcohol, or diet or other drugs. Leading causes of death include those that are associated with the common conditions, so heart disease, cancer, stroke, etc. So assessing an elderly person can be challenging because of communication issues, hearing and vision deficits. You notice there in the opening slide that our gentleman that was climbing the mountain, it was actually his son that was holding his arm. So when you have people there to help you and guide you, then that can also make a difference as well and make up for any deficits that that person might have. Complicated medical histories is one of the most common things we tend to focus on. And I most certainly know that even guys within my age range, so the 55 to 65, when I see them at work, a lot of those guys are on a lot of medication, in particular for hypertension, hypercholesterol, and for GORD. And we have to consider effects of medications that people may also be taking routinely. So we've got a tool called the GEMS Diamond. And I want to kind of talk about this earlier on, because we need to consider how we might manage an older person in a wilderness setting. And this tool was created to help us remember what's different about our older patients. So it's not intended to be a format for the approach to geriatric patients. And again, it's not intended to replace our ABCs. So our primary assessment, secondary assessment, they all stay the same. But it's a good acronym, or it's a good tool to use that covers issues that we need to consider if we're assessing an older patient. So this GEMS Diamond is broken down into G, so the geriatric patient. So older patients may present atypically. We have an environmental assessment. So the environment can help give us clues to the patient's condition and the cause of the emergency. And we can take a lot of that, especially in a wilderness setting, because an older person is going to suffer from hypothermia, the same as a younger person might. But it's about the onset of those conditions. So in particularly cold condition, a younger person may be able to tolerate those environmental conditions much better than an older person, even if they had identical equipment, clothing, etc. Medical assessment. What we must do with our elderly patient is obtain a thorough medical history that's going to include pre-existing conditions, past medical conditions, things like surgeries. Patient could have had a hip replacement or a knee replacement, or have hypertension, diabetes, etc. For the S of our GEMS Diamond, we've got our social assessment. So some older people may have less of a social network. And arguably one of the reasons why older people are venturing into the wilderness is they want to improve upon that. Maybe they've got fed up with being on their own or feeling lonely for too long. Maybe they've lost a life partner or something similar. In other words, this is their way of reconnecting with the world by venturing out into the wilderness setting. Now, they may also need assistance with activities of daily living. They also may need assistance climbing up a mountain. Consider obtaining information pamphlets, though, about some of the agencies for older people in our area too, and try and get a better understanding in the wilderness setting of your population that you may get in the wilderness setting that you may find yourselves in. What we've done is we've put this in table form. If you want to do a screen save, this is a really good way of remembering this tool. Maybe it's something that you can print out. So again, geriatric patients, environmental assessment, the medical assessment, and the social assessment. So let's look a bit closer at changes in the body. So the aging process is accompanied by changes in physiologic function. So all tissues in the body undergo aging, and the decrease in the functional capacity of various organ systems is normal, but it can affect the way in which patients respond to certain illnesses or even injury. So normal changes should not be mistaken for signs of illness. So aging is a normal process. Genuine symptoms should not be attributed to just getting old. So people like myself, we're notoriously guilty if I've got a bit of an ache and pain. Oh, it's all right, I'm just getting old. But that ache and pain could be something, for instance, the early signs of some kind of malignancy, so some kind of cancer, things like bowel cancer. So screening for us kind of elderly people needs to take place to try and find these things out. For myself, I have medicals routinely because of the environment that I find myself in. So I actually have the opportunity of medical screening on a frequent basis, when a lot of people don't, who are venturing out into the wilderness. So again, in tabular form, this is something you can do a screenshot of. I've put together changes in the body. So changes with aging versus the clinical consequences. So it will affect the central nervous system, the respiratory system, the cardiovascular system, the endocrine system, the renal system, gastrointestinal, and also bones. We need to consider the clinical consequences of aging and the effects that they have on the body systems. So if I wanted to think about physical activity and a patient's, or should I say an elderly person's ability to perform, we tend to focus on the respiratory system and the cardiovascular system. But we also need to consider bones, gastrointestinal, and renal as well. So in terms of the renal system, if we have an impaired fluid balance, our patients can become dehydrated quicker than other patients. So we have an increased risk of dehydration or even overload. And if we want to give our patients drugs, so let's say it is necessary to pre-medicate with a drug if we were going to travel to altitude, that drug may not work as effectively on that older person as it would on a younger person to mitigate against altitude sickness. So it would take me a considerable amount of time to go through each of the changes of aging on this list, as well as the clinical consequences. But hopefully you can take that away with you and you can come back and look at that a little bit later. Suffice to say, over a number of years, there will be changes in the body. So think skeletal muscle. Think about people's physical ability to perform. A lot of activities in the wilderness usually require some travel over distance, especially when it comes to hiking and walking, and also climbing as well. So respiratory function is obviously very important. But then consider the diet. We still need to eat. We still need to expend energy. So the digestive system plays an important function, and the ability to be able to absorb as well as excrete nutrients plays an important part of our bodily function and ability to physically perform. Not forgetting the skin. So arguably the skin is the largest organ in the body, and don't forget it's helping regulate things like temperature. And I already mentioned about hyperthermic or maybe hypothermic patients, or the risk of those conditions. Collagen is a chief component of connective tissue and bone, and elastin helps to make skin pliable. And reproduction of these proteins slows as the body ages, and bruising can become more common. And sweat glands do not respond as readily to heat, in which case the elderly person or older person may suffer some kind of physical injury due to not being able to perform as a younger person might be able to in hot climates or environments. As I mentioned, as we get older, and unfortunately, I think has also become part of society, more and more people are taking medications or medicines. Personally, as part of my lifestyle, I don't like taking medications. What I tend to take a lot of is supplements. That supplements my diet and gives me the additional minerals and supplements that I need to be able to perform because of decreased physical function in some areas of my body. So we are more susceptible to toxicity of medications because of things like decreased kidney function, issues with the gastrointestinal system, as well as vascular flow in the liver. So we have to be mindful that if we have anyone who's traveling to the wilderness, and not necessarily just elderly, any medications that person may already be taking. And that isn't just prescription medication. It may also include over-the-counter medications, or OTCs, as we tend to commonly call them. But we have common medications that are used by elderly people that include things like aspirin. So we are told that it reduces the risk of heart attacks. We're told it reduces the risk of strokes. So it's something that we commonly take. Routinely taking things like antacids or decongestants. All of these things can have a negative effect if they're mixed with other substances as well, especially alcohol and prescription medication. So it's something we need to be mindful of. We have a thing called polypharmacy, and essentially this refers to the use of multiple prescription medications by one patient. So I most definitely know in my work environment that if I've got a person who is taking an antihypertensive medication, most likely they're taking hypercholesterol medications, and they're also taking a proton pump inhibitor as well. So with one medication comes two more to negate against the side effects of one of the other medications. And this is common. So negative effects can include overdosing and negative medication interactions as well. Medication non-compliance also tends to occur. Some people just can't afford their medications, or can't get the medications they may need to be able to treat their condition. And you know, the ability to be able to move around and get hold of things, as well as even remember what we should be taking at a period of time. And we tend to rely more and more on other people to help us with that. Not forgetting the impaired cognitive vision and hearing ability. Well, I'm wearing my glasses now, and I would be honestly lost without them, because short-sightedness is something that's creeping up on me at a rapid rate. So I think when we find ourselves in the wilderness setting, what we tend to find is there's more traumatic type incidents than there are medical type incidents. But that's not to say those medical incidents don't occur. And trauma and the geriatric patient don't tend to go together very well in terms of being able to manage these incidents. So these conditions create risk and complicate assessment. Remember, with age comes slower hemostatic compensatory mechanisms, limited physiological reserves, normal effects of aging on the body here play their part, and again, those existing medical issues. Physical findings in older people are also more subtle and can be quite easily missed. Those mechanisms can be much more minimal, but have a greater impact on our geriatric or our elderly patient. And recuperation from any kind of trauma is going to be longer, and it's often less successful. So in other words, if I'm going to sustain an injury now, I tend to sustain that injury, the pulled back or the twisted ankle, because of the overweight bag that I've been hiking with, or I just managed to turn my ankle over on a path. It takes longer to recover from that, and can also leave me in a position where potentially it could increase the risk of those same incidents occurring again. A lot of injuries tend to be under triage. We ignore them because we think they're going to be okay, which means they're going to be undertreated, and they're never finally resolved. Falls are some of the most common mechanisms of injury for elderly people. So we have to have these safety and environment factors. Think about poor lighting. There's a lot of us that go hiking overnight. We might go into the wilderness where there's poor lighting if we're in a tent. Imagine moving around a camp environment where there's probably an awful lot of trip hazards as well, and not having a good appreciation of where you need to place your feet. Things like loose floor coverings. I can think of tarpaulins in the bottoms of a tent, or even outside of a campsite. And most certainly a lack of handrails. In other words, when we fall over, there's nowhere to put our hand out onto to catch our fall. Vision imbalance issues can be a contributing factor to falls, as well as decreased visual acuity and decreased strength as well. And elderly people are more likely to experience burns, and the risk of mortality associated with this is increased when pre-existing medical conditions exist. Again, the immune system is weakened, and fluid replacement is complicated because of renal compromise. There's a higher mortality from penetrating trauma also in older adults, especially in the case of gunshot wounds. You might think, well, what's this got to do with with hiking in the wilderness. Don't forget that people will go into or venture out into a wilderness setting because they go hunting. Hunting, shooting, fishing, as we say, are very popular pastimes. And you may get gunshot wounding as a consequence of a hunting incident or accident. Penetrating trauma can easily cause serious internal bleeding, and trauma can also be caused by abuse as well. So not forgetting that some older people can be abused. Some older people, especially when they're with groups of younger people, may push themselves unnecessarily, or they may find that they're subject to maybe ridicule. Hey, come on, you need to keep up. And they feel obliged to be able to do that, to keep up with the youngers when they're maybe not as physically capable to do it. And whilst not a direct form of physical abuse, you could argue it could be a form of bullying, although it would be by your peer group. Anatomic changes in trauma, like I said before, changes in pulmonary, cardiovascular, neurologic, and musculoskeletal systems make older patients more susceptible to trauma. And our geriatric patients' overall physical condition is going to lessen the body's ability to compensate for the effects of even simple injuries. So if we think about falls, these tend to result from fainting, that we could have cardiac rhythm disturbance and medication interactions I've already mentioned. So consider that a fall may not be just because of a loose rock. That fall may have been caused by a medical condition that's gone missed. Not all of our patients may report their medical histories to you, even as a guide or as a responder. So osteoporosis, like I said, can leave people prone to fractures, especially if we think about vitamin D and calcium deficiencies as well. So this is one of the reasons why I take vitamin D. I don't get enough sunshine, and I take calcium as well because of my level of physical activity. I want to make sure that my load carrying capabilities remain relatively unaffected. Anyone with osteoporosis, is also going to be at risk of pelvic fractures as well. So consider MOI, and consider that if we have any kind of fall, any kind of lower limb injury, you're not going to harm your patient if you put a pelvic binder on that patient, because we should consider pelvic injury. If you can imagine that a pelvic injury on its own, you could lose a significant amount of blood, addressing that potential earlier in a patient is going to be better for them. We would not want to have a patient die because of a pelvic fracture unnecessarily. We also need to consider that the brain tissue shrinks with age as well. So older patients are more likely to sustain closed head injuries. We need to think about strokes. We need to think about hematomas, subdural hematomas, and serious head injuries are often missed because the mechanism may seem relatively minor. Other factors that predispose elderly patients to serious injury, head injury, include alcohol, or recurrent falls, or also anticoagulant medication. I've already said that medication plays an important part in the elderly person going into the wilderness or a wilderness setting. So let's look at some guidelines for fitness then. How do we determine if somebody is physically capable? Well, in order to do that, there has to be an assessment process. And that basically means that whoever's venturing out into the wilderness, young or old, goes through some kind of screening process. And more often than not, people do not seek the permission of their family doctors, of their medical practitioners before they venture into the wilderness. More often than not, there is no medical screening. So physicians, health practitioners must be aware of potential interactions between environmental stresses and pre-existing disease. So this is a reason why we are doing this lecture now. The single best criteria for deciding suitability for any wilderness trip is our patient's previous experience and their exercise history. Arguably, it's what's gone before. But there's no reason to restrict a patient who has recently undertaken similar activities and who maintains an adequate level of fitness. So what I've done here is we've classified what we would determine as a wilderness venture. So we've got class 1 to class 4. So class 1 are our extreme performance ventures. But class 4 are those things that we would consider to be therapeutic. In other words, they're good for our health. What we tend to find is as a lower amount or a small amount of our wilderness population actually take part in the extreme performance ventures. And we're more likely going to find the younger people doing those things, like our high altitude mountaineering, the Everest climb, etc. Whereas if I work my way down to class 4, for more than a century, physical activity has been recommended for certain individuals, especially those with cardiovascular disease. So going into the wilderness can actually be part of a treatment process to ensure that somebody improves upon their current level of fitness. And what we can then do is we can break this down into groups of people. So group A are those people that demonstrate high performance. So we're going to find these people that are commonly going to be athletes who are in training, mountaineers that are continually active, again, who are training, or any worker that might be involved in a heavy physical task. If we go to category D, which I'm going to focus on in a second, we've got individuals that are risk factors. So our category A, these guys are healthy, they're vigorous individuals, and they have little or no pre-existing medical conditions or issues, whereas our group D do. So these individuals are at risk because of their age and also their lifestyle choices. They may smoke, excessive alcohol consumption, or factors that may be out with their control, so congenital disease. And most of our elders find themselves in this group. If we have an individual who's manifestly ill, so basically anyone at any age with chronic illness or physical limitations, then really these are people that we wouldn't expect or wouldn't want to go into a wilderness setting because of the potential risk. However, that doesn't mean to say those people can't. Put it this way, if you can provide wheelchair access, why shouldn't a person enjoy the view, so to speak, any more than anyone else? So individuals who plan to participate in wilderness ventures probably have already been through some form of natural selection. So, for example, a person who aspires to participate in an expedition to Mount Everest will in all likelihood have already participated in something similar. And this person would most likely be a participant in groups A or B that we see here. So an individual who's healthy but has not recently been involved in vigorous activities has become deconditioned. So they may be placed into group C. And the motivation may be a desire to reaffirm youth or vigor in some form of exciting or hazardous activity. But these individuals deserve the scrutiny of organizers with perhaps an assessment before they venture out into the wilderness in order to consider risk factors or other occult health problems. So elders considering wilderness activities should consider the appropriateness of their participation after medical and functional examination and classifying them. So the American College of Sports Medicine, they've developed a position paper on exercise and physical activity for older adults. And that paper should be reviewed by any serious student of the subject. Arguably, we are students of this subject. And those recommendations include endurance training to help maintain and improve cardiovascular function and strength training to help offset a loss of muscle mass. Standards for exercise programs for subjects with disease are also available from the American Heart Association, and they've been available since actually 1979. So this is nothing new. So in summary then, Assessing an elderly person can be challenging because of communication issues, hearing and vision deficits, an alteration in consciousness, complicated medical history, and the effects of multiple medications. With changes in the respiratory system, such as decreased ability to cough, geriatric patients are more likely to present with pneumonia or respiratory diseases. Changes in the cardiovascular system can lead to atherosclerosis, the risk of aneurysm, stiffening heart valves, orthostatic hypotension, venous stasis, deep venous thrombosis, to name but a few conditions. Many patients that we could come across that are within that elderly category do not present with classic symptoms of chest pain if they are experiencing a heart attack. Dementia and delirium must be carefully evaluated also, because that dementia, or what we're considering to be dementia or delirium, could be attributed to something else, i.e. a head injury or the effects of a medication or having not taken a medication. As the body ages, bones become more fragile, and that in itself leads to a higher risk of fracture, especially in that age group. Polypharmacy and changes in medications can cause serious problems for geriatric patients, and we should always consider medications when we're thinking about fitness for somebody to participate in any kind of outdoor activity. But we shouldn't openly discourage it because somebody is taking medications. We need to look at what they're taking and consider other alternatives by improving their health, by improving upon diet, and by improving on exercise, may actually get rid of the need to take the medications in the first place. Depression. People venture out into the wilderness because they may be not happy about their current lifestyles. They're not happy about that day-to-day grind that they've had to put up with for the last 50 or so years. And they may be depressed. That may be their motivation for getting out into an outdoor setting. Most certainly, depression is treatable by going into the wilderness or going outdoors, getting good exercise and following a good diet. It's not just treatable with medication. So I would consider certainly my outdoor ventures to be part of my therapy. And I think that should also be available to other people as well. The risk of serious injury or death is more common in elderly patients who experience a traumatic injury, though. So guys, what I've done is I've put together some resources for you. And I hope this is giving you a good overview of the elderly patient in a wilderness setting, but also some of the other things to consider. I don't think we should be discouraging anybody because of their age in going out and partaking in outdoor activities. And I think it can be very therapeutic to be able to offer that to someone, regardless of who they are and regardless of their age. Some resources I found here which were really good for information were the American Journal of Lifestyle Medicine. Urban Shimizu wrote about elders in the wilderness, and this was a brilliant article and actually helped guide me through putting this presentation together. The Wilderness Medicine Institute, so National Outdoor Leadership School, a really good article here about what really happens out in the wilderness in terms of patients. And this is where I've been able to come up with the conclusion that actually it doesn't matter whether you're young or old, you're just as capable of sustaining an injury or encountering an incident. And it's more about the activity itself, not necessarily who you are. Emergency Medicine Clinics of America have put together some guidance for medical limitations to wilderness travel, which I found particularly useful. And also guidance from the American College of Sports Medicine about exercise and physical activity for older adults. So if you were going to have a conversation with anybody or you were going to promote outdoor activities, then this is something, a resource you could go to if you were, trying to help people who might be interested, or maybe coming to you and asking questions because they know that's the kind of things that you partake in yourself. Lastly, here we've got the wilderness and environmental medicine, epidemiology of wilderness search and rescue. And this is a really good article that explains better than I can about the actual incidences of search and rescue and what types of patients they were getting between the period of 1999 and 2001. This is a few years ago, but I think it's a good foundation. It gives a good picture of what you might expect to find. Some of you here in this presentation may already be working as rescuers, and you've got a better idea of this than maybe I do, in which case I would be more than happy for you to share your thoughts after this presentation. So what I'll do then is I'll open this up to questions. I'll thank you very much for your time and attention. If you don't get the opportunity to ask a question, please don't hesitate to email us at courses@corom.org, or myself, Tim Cranton, t.cranton@corom.edu.mt, and I'll do my very best to answer your questions. So I'll open up the floor.
Great talk, Tim. Any questions?
It's all quiet.
You can unmute yourselves and go ahead if you have a question.
Yes,
Otherwise,
I have a question.
Yeah, please go ahead.
So it's more about toxicology and medication you would take if you have a demographic of elderly people. If you know that some of them have polypharmacy and are at risk of, like, for example, anticholinergic syndrome, are there some specific medications you would take on your trip, like physostigmine or others?
To be honest, that's a good question. And certainly, in order for me to answer that question, I'm going to have to go and get my my pharmacy book to be able to try and come up with some kind of alternative. What I would say is that you're going to need to seek guidance. Where you feel that the risks are going to outweigh the benefits, you've got to consider, is this person's place in the wilderness appropriate? Now, what we don't want to necessarily do is stop them because of a medication they're taking. And I think your question orients more around, should I be taking something? Should I have something maybe in my bag that's going to help them? Is that what you mean?
Yes, exactly. Also regarding, for example, the environment, if I'm in a hot environment and my patient's sweating a lot, then maybe the kinetic of the medication is going to be different.
Absolutely.
Like things like this. So yes, as a paramedic or as a medical student, what would I have to consider?
Yeah, so what I want to consider is the effect of the environment on the patient more than anything. So the medication should still work, but is the environment going to exacerbate the effects of that medication? Or is it actually going to stop the medication from working? And that's a really difficult question to have to answer, because each individual, may perform differently, or their ability in that environment may be very different, which also means the pharmacy effect is also going to be very different. So it's a difficult question to have to answer. What I would like to think is that if I make sure that those patients are getting plenty of rest, if those patients are maintaining good hydration, and those patients we are able to put into an environment where we can keep them cool, or most certainly take rest breaks, we should hopefully mitigate against those issues. What I would have to do is get a list of all of the medications that person may be on, and then take that away prior to deployment or prior to going to that particular area, and look at, are there any environmental factors that are going to affect this patient if they are taking that medication? And that's something done before they go, as opposed to a reactive measure. Because let's face it, in an emergency, it's already too late. So we're going to have to default back to our patient assessment, primary assessment, secondary assessment. And really, whatever they're taking doesn't really change that. We're always going to go through our C, A, B, C, D, E. When we get to D and drugs, then maybe we have to consider why it's caused this, and is there anything I can do? But most likely that's going to be rehydration. Can I give a medication that's going to put them back into the condition that they should be in? Very difficult to do. You're going to have to carry an awful lot of equipment and an awful lot of medications. Screening. I think screening is the answer, and deciding, is this patient fit enough pharmacologically to go into that area in the first place? Does that help answer the question? I don't think it's specific, but it's prevention as opposed to cure. Does that make sense?
Yeah, no, it's a great answer. Thank you very much.
Thank you. Anyone else? Thank you for that question, Lena. I'm hydrating now, by the way, because it's warm inside my classroom. Anyone else? Vish. Okay, hang on a second. Let me just check the messages. So yeah, Vish has made a really good statement there, that as a trip leader, I'm not necessarily a trip leader, but what I would do most certainly with some of my students is I may take them into a training environment. And because we specialize here at the college in remote healthcare, we often take our students into that environment and we enact certain scenarios, etc., when it comes to incidents and accidents. So very much the same as Vish here, that as a leader and being responsible for the care of other individuals, I would like to have to think about regularly checking on my team members and ensuring medication administration and any issues with nutrition and hydration. And I actually practice this as a scout leader. So I'm looking after a predominantly pediatric group of patients, but I will have certain members of that group. Now, last summer camp that I did with my scouts in the Czech Republic, I had over 120 individuals that I was managing. And, you know, out of those individuals, I had 15 or 20 of my younger people, as well as some of the older leaders that were taking medication routinely. And we would make it a point at certain times of the day that during breakfast, I'd check and make sure people were taking medications. I'd also check on people during the course of the day. Hey, how are you feeling? You know, it's really warm. Have you had a rest period today? Are you well hydrated? And making sure that people are looked after. So again, to re-emphasize what Vish is saying, there's an ongoing level of care, and there's a monitoring of people that we may also be responsible for if we find ourselves in that particular setting. So thanks for making that comment, Vish. Any other comments there? Any messages? So guys, if you do have any questions, they can be sent in this chat, and I can address them as well.
I'll wait for about 2 minutes more before we close down this.
No problem.
And any questions, Tim has already given his email out, so send an email out. We would be more than happy to answer any questions about the college, about this particular lecture, about courses that we run across the globe, and also the Wilderness Medical Society.
I mean, one thing I would say that, you know, as a form candidate myself, and you know, relating to you guys and the environments that we find ourselves in, I've actually found this has been a really interesting subject to research and look at. And I've actually felt that I could probably talk for hours about this. Yesterday evening, I had 120 something slides, and I had to get that down to less than 60. And I feel I've almost rushed us through this subject. It's definitely an area for study, and it's definitely an area for further research. Hopefully the links that I provided there at the end of the presentation will give you a good starter for 10. And again, I would encourage you to look at those. So what I'll say then, Vish, is if it's okay with you guys, I'm gonna jump out, and I'll thank you all for attending.
Thanks so much, Tim. I'm going to turn the recording off right now and probably going to stop